Knee osteoarthritis, or OA, is a common condition that causes pain and joint stiffness, significantly impacting daily activities. Despite strong evidence that physical activity can alleviate symptoms and enhance quality of life, only about 10% of those affected engage in regular exercise. A groundbreaking study from the University of South Australia is exploring why this discrepancy exists. The research reveals that many individuals with knee OA may subconsciously believe that exercise could worsen their condition. The study surveyed individuals with knee OA and found that a significant majority, 69%, harbor implicit beliefs that exercising is hazardous. This stark contrast to common medical advice, which advocates for physical activity as beneficial, highlights the psychological barriers faced by patients. Brian Pulling, a PhD candidate at the University of South Australia based at Sahmri, and the lead researcher of the study, emphasizes the importance of understanding these implicit beliefs to better tailor treatment plans. Traditional methods, such as questionnaires, may not fully capture these subconscious fears, leading to a gap between what patients express and what they truly believe. This insight into the psychological barriers could explain the low levels of physical engagement among knee OA patients. To address this issue, the research team developed a novel tool to detect and assess unconscious beliefs about exercise. The tool, an online implicit association test, prompts quick responses to words and images related to safety and danger associated with exercise. This minimizes the influence of deliberative or socially desirable answers. The results from this test revealed that even participants who overtly stated they were not fearful of exercising showed underlying concerns on this implicit level. This tool could help clinicians identify patients who might struggle with exercise adherence, despite outwardly agreeing to activity recommendations. Associate Professor Tasha Stanton notes the potential of this tool to revolutionize how health professionals support OA patients in becoming more active. By understanding both the explicit and implicit attitudes towards exercise, therapists can better address the deep-seated fears that prevent engagement in beneficial activities. This could lead to the implementation of tailored interventions such as pain science education, exposure-based therapy, or cognitive functional therapy, particularly for those who might not typically be considered fearful of exercise. The researchers are now looking to validate whether these implicit beliefs directly correlate with actual behavior by encouraging further participation in their implicit association test. The goal is to use these insights to improve interventions and encourage more effective management of knee OA through increased physical activity. By addressing these psychological barriers, we can help more individuals with knee OA lead healthier, more active lives.